Hello, this is Dr. Gay from First Look MRI, and this is a patient born in 1991. They have pain in their lateral knee from a hiking injury. They stretched their knee, hurt it while they're hiking, continued lateral pain for a few weeks. And if we look on this view here, this is a coronal fat sat PD sequence. This is the medial side, nice medial meniscus. Here's the lateral side, lateral meniscus. And the medial side looks normal. This is the medial collateral ligament. And now we're going to talk about the lateral collateral ligament complex. And they have just a couple minor findings out here on the lateral side. So this is part of the lateral collateral ligament complex. This is called the fibular collateral ligament. It comes off the femur, and it comes down here, and it blends with the biceps to form the conjoined tendon. So here's the conjoined tendon going to the fibular head. This is the fibular collateral ligament. And if we go towards the back here, we see this, the biceps muscle comes down. It's kind of variable how far down it comes. The muscle ends about here, and then it joins with, again, the fibular collateral ligament right here to become the conjoined tendon. So this looks good out here. We'll put up another view to see this a little bit better. But they just have a mild sprain over here of the fibular collateral ligament origin, right where they're hurting. And also beneath that, we see the popliteus tendon. It comes out of this little trough here. Popliteus tendon comes down, wraps behind underneath, right next to the meniscus here, comes obliquely down. You can see the central tendon fibers, and this is the muscle. And so they have a sprain of this fibular collateral ligament, and then also a strain of this underlying popliteus tendon. Kind of minor findings here, but just good for the basic anatomy. So here we go. One more time. This is the fibular collateral ligament. Normally this is much better defined and dark, but here's foggy, kind of bright and thickened, and the popliteus tendon beneath that. Normally we can see something relatively dark. It can be hard to see here with magic angle phenomena, but there's just a little bit too much signal within the popliteus tendon underneath that as well. So they had a couple findings. If you're worried about this to see if this is real or not, you can put up the axial images. We're going to look at that biceps again. We go towards the back. Here's the biceps muscle. Here's this the conjoined tendon. We go towards the front. We see the fibular collateral ligament coming around. Again, that fogginess. And then underlying it, this popliteus tendon that's injured. If we go forward even further, we get into the iliotibial band, the ITB, coming down here and attaches here on Gerdy's tubercle. That looks normal. Now, if you have any questions, put up the axial images here. Here's where we're looking at on the outside. And right here, this little area that's too bright, too thick. This is that fibular collateral ligament origin, so you can see that this is abnormal. Instead of being clean, it's thickened. And if we go down a couple of cuts, we see this is the fibular collateral ligament. And underneath here is the popliteus tendon origin, and that is not normal either. It's bright. And if we come down here, we can see the popliteus wrapping around the back. It's called the popliteus hiatus in here. Go back up, 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 and you can see right here where it attaches, just too foggy. So a partial tear or strain of the popliteus tendon origin, and this injury of the fibular collateral ligament origin. And that's it. Thank you very much.